And so you're practicing bringing the top-down control of thoughts and feelings along with awareness of your heart and breathing, along with actual literal physical controlled slow breathing. That's effective.
Discovering who you really are can be the most exciting adventure of your life if you have the courage to look deep within, face your fears, and overcome your self-limiting beliefs. Welcome to the most exciting adventure of your life. Welcome to a new way of living, and welcome to the Fierce Planet Adventures podcast.
Hi, I'm Casey.
And I'm Andy. And we're on a mission to inspire and guide 1 million people to live a life of purpose, passion, and self-mastery, leveraging the 5 mountains of cutting-edge human development to build extreme mental fitness.
Today, we are speaking with Dr. Ginsberg. He earned a BS in biology, cum laude, from Yale University, MA in anthropology from Brandeis University, MA in psychology from Boston College, and PhD in clinical neuropsychology from the University of Memphis, Tennessee. Presently, he is a licensed clinical psychologist, neuropsychologist in South Carolina after retiring from the Columbia, South Carolina VA hospital in 2019. He's currently adjunct faculty at Saybrook University and research associate professor at the University of South Carolina School of Medicine. Dr. Ginsberg has been a principal investigator, co-PI, or co-investigator on research grants from the DoD, VA, and NIH studying heart rate variability and HRV biofeedback in patients with either chronic pain or PTSD. Currently, he's collaborating with researchers at Virginia Commonwealth University School of Medicine, Duke University School of Medicine, and University of South Carolina School of Medicine on grant proposals under review by NIH and DoD to study heart rate variability and heart rate variability biofeedback. Dr. Ginsberg has advocated for integrative management of chronic pain and PTSD using autonomic self-regulation as a self-empowering mind-body treatment for the past 15 or more years. He authored or co-authored more than 70 peer-reviewed scientific publications, chapters, and abstracts, served as a scientific reviewer of research grant proposals for NIH, the VA, and the DoD, and edited or reviewed numerous published scientific articles. In addition, Dr. Ginsberg has given invited presentations on HRV and HRVB at scientific meetings, academic seminars, and webinars. He was also program co-chair of the Association for Applied Psychophysiology and Biofeedback Special 50th Anniversary Annual Scientific Meeting in Denver, Colorado. Welcome, Dr. Ginsberg.
Well, thank you, Casey and Andrew. I'm delighted to be here. Thank you so much for hosting me.
Absolutely.
We're very happy to have you to talk about a very, very interesting and important topic. And that is heart rate variability. But before we get into that, we've got an opening question for you.
What are you most excited about in your life right now?
Oh, having a little different perspective on time management. At my stage of professional career, I'm able now to self-direct and use my time with much more freedom than ever before. And so now I have time to pursue interests that I have and a little bit of relaxation even. That's the best thing in my life right now.
That's a great place to
Fantastic.
be. Well, let's kick it off. Heart rate variability, HRV. What is it?
Well, that's a wonderful question, and I'm glad you asked it. We think of heart rate, it's just pulses, just beats. By definition, in a simple but strict physical definition, heart rate is just something over time, whether it's distance or frequency of something. It's just over time. In order to measure heart rate, then we have to have some unit of time. Typically, beats per minute. HR is reported typically in beats per minute. A normal heart rate is 60 beats per minute. Now, here's where the interesting part comes in. Heart rate variability is not heart rate. Let's take our example of 60 beats per minute. Well, there are several, but I'm only going to talk about two ways of achieving a heart rate of 60 beats per minute. One would be each beat is separated by 1 second. And so you have 60 beats in 60 seconds. You would have a heart rate of 60 beats per minute with separation, or technically the interbeat interval, would be equal at 1 second for all beats. Now, another way that you can achieve a 60 beat per minute heart rate would be if you had, let's say, for example, 30 beats that were separated by 0.9 seconds and 30 beats that were separated by 1.1. When you average them over the 60 seconds, you'll get 60 beats per minute. But the units or the IBIs in between are not the same. The first case would have heart rate variability of 0. All of your IBIs are the same. Your heart would essentially be a metronome. Tick, 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 units all the same. If you have variability in those interbeat intervals, you begin to have the makings of what we call heart rate variability. Now, here's the surprising thing. It's very, very important. It's foundational, really. Heart rate variability is good. A healthy heart is not a metronome and does not have equally spaced beats. A normal functioning heart is responsive to respiration. And in fact, there are slight but easily measurable differences in IBIs within the respiratory cycle. So when you inhale, if you inhale and hold if you take 5 seconds to breathe in, your heart will accelerate slightly. The interbeat intervals will decrease, meaning the beats are closer together, and so your heart rate is faster. And that is measurable. When you exhale, your heart rate will slow down during the exhalation portion. And this is all due to the homeostatic mechanisms controlling blood flow, circulation, as it relates to respiration and any exertional or demands there might be on the heart. But in the normal resting state, if you are slow breathing, your heart rate will increase on your inhalation and it will decrease on the exhalation. That is critical. That's crucial to understanding heart rate variability. That's normal, that's healthy, that's good. A trained athlete, someone in excellent physical condition, may have a change in heart rate, that's the IBIs in the individual intervals, corresponding to as much as, I'm going to pull a number out of the air, but I'm going to say about 20 to 25 beats per minute change on acceleration and deceleration within a respiratory cycle. Well, that's a good thing. That's a healthy heart that is responding physiologically to changes going on homeostatically in terms of the brain, the baroreceptors in your circulation, in your aorta, will sense the changes in heart rate and will send signals to central nervous system. Central nervous system sends signals back to heart, which will adjust the heart to account for these changes in acceleration and deceleration. That is necessary to maintain blood pressure homeostasis. If you didn't do that, then you'd be having these swings in blood pressure due to the acceleration and the deceleration. That's heart rate variability in a nutshell. Heart rate variability is the change in IBIs, which corresponds to heart rate, individual beats, the change in IBIs over respiratory cycle. And that's called RSA, respiratory sinus arrhythmia. It's normal and it's healthy. So the good news is that a healthy functioning heart that has no heart disease in an individual who is not overly burdened with stress or any medical conditions will exhibit this normal variation in heart rate over the respiratory cycle, where you can measure, you can easily visualize increases in heart rate or acceleration on inhalation, on a slow, deep breath, and then a deceleration. The heart will slow down measurably in IBIs on acceleration. So when you and I do a cleansing breath, if I can increase your awareness through mindfulness and so on to the effects on your heart, you can become consciously aware of the effects of breathing on these very slight changes in your heart rate. That's the approach to good physiological maintenance and self-care.
Okay.
Any other questions right now about the basis of heart rate variability?
Just one, and this is, I was in the hospital a little while back, I think last year, for a routine procedure, but one that was going to require me to go under anesthesia. And pre-op, they had me hooked up to the monitors. And as part of when I was waiting, I was doing my breathing exercise. And I kept tripping the alarms on the monitor because I would do a long inhale and then a long exhale. Is that what you're talking about right here? Is that
is what I'm talking about?
Okay.
And we're working on it. I mean, this is being recognized, and there are, I'm going to say, programs or protocols or procedures in surgical suites that I'm aware of where either slow, deep breathing or music or other types of interventions that can improve the heart rate variability by slowing breath or by causing relaxation from central nervous system, what's called top down. You can achieve this with mind control, so to speak, or emotion regulation. But breathing is the fastest, most effective way to increase heart rate variability.
When I think about energy and vitality, I think about a kid. They have the energy to play, run around, climb things. That energy that feels like you just can't contain yourself. It's the stuff we've always wished they could just bottle up and sell to us, right? Well, this company's found a way to do just that. Amari's Happy Juice Pack. Mood, motivation, energy, things our bodies can naturally produce when both our guts and our brains are happy and communicating. And we can actually improve that process of communication across the axis of the gut and the brain. This is cutting-edge science. This is game-changing information. This is where science meets soul. This is Amari, and we're helping people feel better naturally. Boost your serotonin and GABA. Balance your neurotransmitters. Nourish your gut. The things that make you want to do. Start feeling better the natural way. Check out the links in the show notes for discounts and more information.
Wonderful. Does age play a role in HRV and heart rate variability? And is there a target?
There are ranges for different ages and different conditions. We're just talking about normal, healthy populations now. Mm-hmm. And to answer your question about age, clearly there is a decline in normal heart rate variability with age. So if when I was 30 years old, if I was in good health, my heart rate variability may have been at a certain level. And there are many quantitative measures. I mean, almost too many, but there are lots and lots of ways of measuring or extracting data from a series of IBIs or pulses. But one of them is to look at the max min over a respiratory cycle. And you can achieve that very simply. So if I was under carefully controlled conditions, I was in good health, and I was about 30 years old or younger, let's say, I might have had a heart rate variability max min of, let's say, 12 or 15, which is sort of normal for someone who's not highly trained. Nowadays, if I did the same test, the same protocol at my age, which is a little older than that, I'm actually 70, my heart rate variability on a good day would be, I'm just kind of pulling numbers out, but it might be 8 to 10. So there are several studies that have looked cross-sectionally at changes in heart rate variability with age, and there is a decline. But my point is that if we did this study longitudinally within an individual, we would also see a normal decline in healthy populations. But the ranges vary. So if we took a cross section of 30-year-olds who were in good health And we would still find some ranges there. For example, height. One of the differences that is related to height is the blood pressure. And so there are changes that have to do with height, all things equal, because of the pumping action of gravity. You have to oppose gravity in a taller person. And so those also have subtle effects. But there are ranges and there are publications in normal healthy controls, college students, as well as young adult populations. And so those variables are known. And the ranges are, I mean, they're fairly wide, and you could still be considered normal. So the way that it's done in the clinic is there's typically, it's not so much the rate where you fall in the range, but if you exceed a certain cutoff. And so if a cutoff for one of the measures, and I'll throw this out there without being too technical, but SDNN, which is the standard deviation of normal to normal pulses or IBIs, if your SDNN is measured to be less than 50 in a heart rate monitor, an overnight heart rate monitor, it's generally thought that there's something wrong. Whether you're 30 years old or whether you're 60 years old, if you go below the cutoff, that means that this heart is not likely to be healthy. So there are ranges for normal function. They're fairly wide. And then there are cutoffs beyond which it's thought, and it does appear to be true, that it can discriminate between healthy and not healthy individuals.
Fascinating. Do you have a sense if sleep apnea plays into the effects of heart rate variability, or how heart rate variability shows up?
It does, absolutely. Apnea is clearly has impacts. And honestly, if I had a patient in the clinic who said to me, I have apnea, at the start, I would really recommend and encourage them to seek treatment for their apnea before we did any heart rate variability. It's going to override. So you cannot treat, or you ought not try to treat apnea with a heart rate variability biofeedback intervention.
Okay. Yeah.
That's a separate condition, right? So it's limited. It is, it doesn't, it's a very powerful tool, but there's some conditions. I wouldn't take on a cardiac patient with heart rate variability biofeedback.
That makes sense.
Interesting. So as far as measuring, I know you're familiar. There's a lot of technology out there, like wrist top heart rate monitors, which I have one. I go out for an activity, and once I hit stop, it pops up a number that says HRV 42. What is that telling me?
I have no idea I have no idea what a wrist, what's called a wearable, what index they would be using for heart rate variability. And so there's a warning there that, these are generally, they're proprietary. And people, we've certainly looked at wearables and tried to use them, and you can't really, they're not that useful for clinical type of measures where you need to have really the IBIs per se. You need to be able to analyze the IBIs. I don't know what software algorithms are built into different wearables to produce what they call an HRV. And some of them might be, standard, legitimate type of transformations, but some of them might not be. And without some real clear guidance on what on earth a 42 means, I would not venture to say. So I don't know how they're measuring, what they mean by that. And a lot of times, a lot of the systems, not just wearables, but even a little more hefty systems, they don't so much report the numbers as they do like colors or ranges. And so if you're in the green range, it sort of fits some predetermined, like I was saying, a normal healthy range, normative value. And so you get a green, but it doesn't tell you what the value is. And it doesn't even tell you which of the many variables it's basing that classification on. So while you can do home monitoring easily of heart rate variability, the wrist monitors are, and those things, they're not going to give you a really full picture of heart rate variability. Now, what it is useful for is comparisons within an individual. So if one day your wristband says 42 and then another day it says 16, that's telling you something. It's telling you that there's some changes, and whatever it is, it's measuring. It all comes down to pulses, and the fundamental foundational data are pulses. They're IBIs. And so if your recording device is measuring IBIs, somehow, some way in there, you can get a heart rate variability out of that. But there are a lot of different ways to do that, and it's hard to say which different devices are doing what.
Okay. Thank you for explaining that.
Mhm.
Important, I think, to call out that it's a good, like you said, a good guide to compare your personal day-to-day, but may not
Right.
give you that full picture. So it's not really a medical measuring device, more of a guide.
That's right. And it gets even very complex, where some of these proprietary things will go on, and they'll report to you what your stress level is, and they'll report to you all sorts of things. And some of that might just be extensions. It might just be sort of, this is what we think, and it seems reasonable. Might not be so validated.
Right.
But it gets very elaborate. So I encourage people to use. I think it's great to use the Fitbits and the different things, the different pulse monitors, for recording your own device, sort of looking at your own stability, your own consistency across time. But it's not useful for comparing to other people or groups or anything like that.
Perfect. Thank you. Great. So we've talked about what heart rate is, what heart rate variability is. How does that translate into how we feel and perform?
Oh, it's crucial, really. It is so central to well-being. Heart rate variability clinically was recognized in the 60s or 70s as being a very, very strong, and is still considered the strongest predictor of heart attack. But what we're saying there is that if it's a pathological heart rate variability, then it tells you something's wrong. If you're in the normal range, then it is useful and is applied in optimum performance, in coaching, in training, as well as in executive functions. Cognitive attention can be shown under controlled conditions to decrease when heart rate variability is out of range, and to be restored when heart rate variability is within range. It creates the idea is, when you get this physiological coherence of heart rate, respiration, and blood pressure that I'm describing here, when you sort of hit that sweet spot of breathing, you achieve a whole body systemic physiological integration or synchronization. So now with each breath, your heart rate is synchronized with that. Those little changes in acceleration, deceleration become synchronized with the actual respiratory cycle itself. And so does the blood pressure waves that are emanating from central nervous system, opening and closing capillaries and vasculature. And you achieve this physiological condition of coherence in which you are optimum for thinking and memory skills, and providing yourself with the ability to respond to challenges and functional challenges, everyday challenges. Now, we have to, it always comes up, you can't breathe slowly. You can't do the 6 breaths per minute, which is about the ideal sweet spot for most people. You can't do the 6 breaths per minute while you're on a soccer field, or in a lot of everyday challenges. You can't do that resonance frequency breathing. But with enough practice, when you're at the computer or you're on the bus or you're doing something which is essentially restful, and if you can, the more that you practice, the more that you achieve this coherence, the easier it is to shift into it when there is a stress challenge. So if you're familiar with heart rate variability and the management of it, going into, whether it's going into a test or a job interview or some kind of physical challenge, you can prepare yourself both mentally and physically then through this very simple and yet very, very effective means of controlling your physiological status. So the idea of coherence is associated with emotional regulation, with thinking and memory, response time, any number of good things. I mean, it's not like it builds up your muscles, but it gives you the cognitive ability, the perceptive ability then to meet challenges in an optimal fashion. And that's the key word. I've got a limit. No matter how much I practice it, I'm not going to go beyond whatever my physiological range is. But if I manage my heart rate variability, I can optimize what my level of function is and what my adaptation is. That's the beauty of it.
Yeah, beautiful. We talk a lot about activating our parasympathetic nervous system through breath control. So if I'm understanding this correctly, we've got, the autonomic nervous system, which consists of the sympathetic and parasympathetic, and sympathetic fight or flight. So when we get scared, nervous, our heart rate may go up a little bit or go up drastically. And to bring us back into that calm, restful state, that's dropping into parasympathetic or activating parasympathetic. Right, and we do that with breath.
Right, with the exhalation, with the exhalation arm, by slowing it down. That's right. So you get full credit for that answer. That is exactly right. In our fundamental state, in our pre-mammalian state, we didn't have the parasympathetic nervous system working in the same way. We essentially only had fight or flight, and everything, any kind of stress or challenge in the environment would produce immediate acceleration and fight or flight. But as we've evolved, we have elaborated the vagal system, which controls parasympathetic. And so we now have this supra or uber control system from central nervous system, from cranial nerves, which tells us that we can rest and digest, which is the flip side. In simple terms, sympathetic is fight or flight, and parasympathetic is rest and digest. It's an oversimplification, and so I don't want you to think that's all there is to it. But yes, parasympathetic means you're in a restful state or relaxed state, and the heart will slow down. So by bumping up, so to speak, or exercising the parasympathetic arm of the autonomic nervous system interplay between sympathetic and parasympathetic, by practicing that slow exhalation, you strengthen, so to speak, that portion of the cycle. Now, remember, these things are they're fairly rapid. We're talking about a 10-second cycle where you can shift from sympathetic to parasympathetic. These are not the same kinds of shifts that you would have if you were faced with cold weather, or if you were faced with a threat, a real serious threat or a serious stress. But the idea is that by practicing the heart rate variability biofeedback, you're strengthening your ability to shift into that parasympathetic mode. And it becomes easier and easier. Another way to think about it is, on the flip side, if you are not doing regular breath control, everyone, because of the challenges of life, tends to exist in a hyperarousal, oversympathetic state. We sort of live from day to day and moment to moment with slightly accelerated heart rates, with psychological stress and pressures and racing brain and all of those things that are hard to achieve without conscious control. And that's so what we say is that we're born with a system, a parasympathetic system that operates normally. So if you look at youngsters before, they begin to experience real serious stress, many of them have no difficulty in relaxing in there. It's a normal, natural state. And we learn how to become sympathetically overdriven. And so a lot of what we do in the clinic is try to unlearn and return to a more basic state where we are better adapted to dealing with stresses in the environment. We have better control over our physiology.
Makes sense. Yeah, controlled environment. All right. So now that we've set up what it is and why heart rate variability is so important, in your experience, in your different roles, and maybe particularly with the VA, how can we use HRV to manage pain, post-traumatic stress, or even chronic stress?
Well, first of all, let me say you can. It is an effective adjunctive intervention for pain, for chronic or sensitized pain, as well as for PTSD, stress-related. It's very effective. It's been proven to have significant symptom effects in depression as well, anxiety, stress, things that are sort of between normal stress and clinical conditions. It does work. So that's the fundamental importance of it. It's the sort of thing that seems so simple, it kind of is gimmicky. And initially, many people are turned off by it because they think, well, you're sort of kidding me. But a clinical psychologist would know from the get-go that diaphragmatic breathing is helpful for about 2/3 of the patients that you see, where anxiety is a factor or stress-related disorders are a factor. Diaphragmatic breathing is the foundation then of controlling heart rate variability, and is the message that we want to bring to anyone who comes in the clinic who's exhibiting either overt anxiety or pain or irregular breathing. I mean, you can visualize in many cases that people have just simply, they don't breathe right. They chest breathe, they breathe irregularly, or they breathe rapidly, and don't understand that you can actually get a calming, emotional calming effect through controlled, slow breathing, slow, deep breathing. And so that's a message that we really, without even talking about whatever issues there might be. And it's as simple a matter as people saying, take a deep breath, calm down. It's really true. It's not much more complex than that at the outset, although it's much more elaborated and there's much more data that can be had. But at the nub of it, if you slow, deep breathe when you're under stress, when you're upset or anxious or emotional, you will get this relaxation effect. It puts you into a physiological state of coherence where blood pressure, heart rate, and respiration are all synchronized, and you can think more clearly. So it is an intervention in and of itself, apart from, in addition to, whatever psychotherapies you might be doing or physical therapies you might be doing. It's sort of giving you top-down control, which then, as I said, it optimizes your ability to function. And whether that's continuing to face a stress or whether that's to eliminate a stress or whatever it is, it optimizes moment to moment function and adaptation to the environment.
So we can use breath for an almost instantaneous state change when
Absolutely.
we're feeling distracted, maybe, the Buddhist term monkey mind, stressful, anxiety. Okay.
That's right. Racing brain is what I like that monkey, but racing brain you'll see that sort of in the literature there, that it tackles racing brain that's associated with anxiety and chronic pain and other things. And it is definitely effective for relieving, at least at the moment, the racing brain. The more you practice, the easier it is to shift into.
This episode of Fierce Planet Adventures podcast is brought to you by 5 Mountain Coaching, licensed Unbeatable Mind Coaching, integrated accelerated vertical growth across 5 domains of cutting-edge development designed by retired Navy SEAL Commander Mark Devine. Learn the Big 4 skills of mental toughness and resiliency. Discover the 6 pillars of performance. Test your mettle with custom-created crucibles across all 5 domains. Visit 5mountaincoaching.com to schedule your free 1-hour Unbeatable Mind Coaching session. That's the number 5, mountaincoaching.com. Begin your journey to becoming unbeatable today. Something we can call upon very easily. I mean, we all breathe.
Right.
We just have to teach ourselves to do it correctly.
Well, look, a shortstop is going to be doing this in between plays. He's going to kind of calm himself down. It's that rapid. And so it's very effective in sports. That's why it's effective in sports. Is teaching people to think clearly, and whatever the physical challenge is, not just where there are clinical issues involved.
Wonderful. So as it relates to post-traumatic stress, in your work with your past work with the VA, how does that come into play? I mean, I can make assumptions here, but I'd rather hear, like, to the veteran
Right.
who's suffering right now.
Well, here's what I would advise. You can find this in the VA in kind of an institutional format, but this is something that can be done on your own. And if you're a veteran and you're being treated for PTSD by any one of a number of approved, of which heart rate variability has not reached a level of being a clinically driven offering or part of the clinical menu in many VAs.
Okay.
Some VAs do offer it. And there, it's a good thing, but for all veterans, it is something that is self-empowerment, and it can be done independent of a practitioner or a provider. However, I think the best way to get this heart rate variability control, this breath control, is with a coach, is with a trained and qualified coach. And you can find coaches in the VA, and you can find coaches outside of the VA. And so you can just do it yourself. Some veterans have showed remarkable facility in picking up the skill. The biofeedback we're talking about, this controlled skill, which includes the emotion regulation and mindfulness, can be taught or trained, and there are levels of certification of trainers, and some people can just do it themselves. But for many cases, it really takes the guidance of a coach. So if you find a coach, either within the VA or outside of the VA or on your own, these are all ways to reach this level of coherence. So for my work, what I found was that people who sort of got it, I want to say independent of what the clinical menu was, they would you can incorporate that into a therapy session easily. If you have a 45-minute therapy session for PTSD, where you're going to practice, let's say, the VA likes what they called CPT, cognitive processing therapy, which is an updated, modernized version of RBT. And RBT goes back to the 60s and 70s. That's a very well-established psychotherapy, but it's effective for PTSD, and the VA offers it to many, many people. A CPT therapist or a prolonged exposure therapist may do a little bit of heart rate variability biofeedback for the first 10 minutes in order to enhance receptivity of a veteran or the individual who is struggling with these obsessive thoughts or with the triggers. And the PTSD is a very difficult, heterogeneous disorder with many, many, many different kinds of symptoms and different constellations of symptoms. And so the presentation can vary depending on one veteran might be just killed by nightmares, and another by startle reaction or irritation or something else. And so the presentations do vary, but regardless of which flavor of PTSD you have, a brief session of heart rate variability, it increases that receptivity. It sort of enhances your emotion control. It enhances your attention focusing, and it enhances your physiological state, calms you down, puts you into a much more receptive state. So it dovetails perfectly with a number of other top-down type of therapies for PTSD. It would, if you're taking medication, say you're taking sertraline from your VA provider. Well, that's fine. There's no contraindication for doing heart rate variability biofeedback in addition to that. So it is adjunctive to many, many interventions for PTSD. And it is also a standalone in some cases for some individuals with acquisition of the skill of heart rate variability biofeedback and practice over long term will achieve lasting symptom improvement.
Outside of the indications or the issues we already talked about, like somebody having heart disease or sleep apnea, is there a situation where HRV would not be appropriate?
Well, those that you mentioned, there are certain disorders, and honestly, even for PTSD, I've seen individuals who were not ready for heart rate variability. So a danger that I've noticed is many practitioners tend to promote it as a panacea, a single agent treatment for all manner of disorders. And I don't think that's right. I think a little bit more care. So in any case where there is notable breathing irregularities and notable but reversible low heart rate variability. So I think the issue is reversibility of a disorder. So, is it helpful for dementia? Yes, what it does is it provides a certain level of basic comfort, and it's widely used in that setting for a lot of cognitive aging disorders. But it's relatively, I want to say, it's not. These are not giant changes in the individual, but it does provide a certain level of useful improvement in function. But it will not stop or reverse dementia or any one of a number of other disorders. And so there's some treatments. Listen, I'd tell you, the first thing I'd tell you is, go get some kind of painkiller for certain types of pain. Mm-hmm. But you should also have heart rate variability in addition to prevent the sensitization. It's adjunctive to everything, and it is standalone for some conditions.
Where do we go from here? How can somebody, or can somebody, I think we've answered this, but improving your heart rate variability, obviously the practice of breath, like we've discussed, but are there any other factors that
Yes.
someone can influence?
Yes. Yeah. The two others are the attention focusing. I go with the and I'm not the only one, and there are different mixtures of this, but my particular concoction is what I call autonomic self-regulation. And there are three essential components of autonomic self-regulation. One is slow, deep breathing, and that's what we've talked about, the resonance frequency. The other two, one is mindfulness, which is focused attention. And we advise people, because it is a physiological intervention itself, I mean, you're directly intervening on the heart, that you focus that mindfulness onto your heart rate, onto your breath. Now, again, mindfulness quite often, there are any number of things that mindfulness can be directed to, as long as it's momentary and there's non-judgmental and you're just heightening your awareness. But for this autonomic self-regulation, it's most useful to focus then on the passage of air, the intake and the exhalation of air and effects on your heart. And then the third component, we have slow, deep breathing, and we have mindfulness. The third is the emotion regulation. And emotion regulation is a top-down process, and it's not really different from rational therapy, but it's a way of managing your thoughts and feelings. Emotion regulation is a standalone psychotherapy. Many people go in for the top-down type of therapies for depression, for anxiety, for stress, for marriage counseling, any number of psychological disorders that are reversible and that are treatable. And so we practice emotion regulation. So the coach has, let's say, a 30-minute or 45-minute is a typical heart rate variability biofeedback. The coach is observing your breathing, and the coach is advising you, can you sense your heart? Can you feel the breath coming? You're getting feedback from the computer screen, which is showing you what your heart rate variability is, showing what your respiration patterns are. So you're getting that feedback and you're becoming aware of it, and you're consciously trying to link up the experience of the heart rate variability coherence with the experience of the mindfulness and then the emotion regulation. And so you're practicing bringing the top-down control of thoughts and feelings, along with awareness of your heart and breathing, along with actual literal physical controlled slow breathing. That's effective. And so that's what I call autonomic self-regulation. That's what I'll be presenting in Dallas. So where we go from here is guys like me and guys like you and Casey, ladies like yourself, to promote it, just to bring more and more awareness that it's not fringy. It is not pseudoscience. It's not, unfortunately, it suffers from the apparent simplicity of it that makes it dismissible, but it's also not a panacea in all cases either. So it's just having an objective, clear picture, what it is, how to do it, and how it works. The more people who can do that, whether they are clinically disordered or whether they are looking for improvements in day-to-day adaptation, or whether they are elite athletes attempting to break a record and be involved in some kind of optimal performance. Same as there are studies of musicians using heart rate variability to improve performance. It's a test-taking strategy. The more people that become aware of it, the better. Now, there's a willing population out there already, and lots of people there's a booming market for heart rate variability devices and trainings. But it is best, I think, to have a qualified professional either show you how, or at least limit yourself to what is really validated, legitimate, as scientific proven approaches.
Would this be a good time to begin talking about biofeedback and going a little bit deeper into resonance breathing?
Yes, of course. This can be done. I mean, it's not dissimilar from what we think of as ancient and Eastern medical practices. But in those in those practices, there was no technology involved. It was something that people understood without having to quantify it or without having to have any kind of assistive devices. And it's still true that people can learn autonomic self-regulation. They can learn it themselves, just come to it, or you can acquire it from reading or from training yourself. But to really be efficient for someone in a clinic, it requires, I believe, I would say, a qualified coach and some simple and easily obtainable devices. And the devices are software, a sensor, and a computer screen. And some of these software applications are on phones. I mean, Casey, in between your Fitbit and a laptop type of system, they're phone apps. And these phone apps can have sensors that attach to either earlobe or fingertip that will sense the pulse. And right there is a key difference between the Fitbit and any of these other devices, is the way that they're sensing the heart rate. And you're getting a much closer count of the pulses when you're sensing directly fingertip or earlobe than on the wrist with a watch. So the recording is really a little bit better. But if you have a simple sensor that is then sending information, sending the signals, the heart rate signals, into a software program on a laptop, which can then generate feedback screens. And these feedback screens are either graphs and displays, they're numeric quantifications of heart rate, respiration, and you can even measure blood pressure while you're doing it. That's a little more advanced, but for a simple home system, a fingertip sensor with the right kind of software and a laptop will give you what you need, and then a coach kind of helping you through it until you can create the right kind of visual quantitative patterns of heart rate and respiration. And the more you do that, and it takes a little bit of practice for some people, the easier it becomes to transition to creating that state without the feedback. So the idea is to acquire the skill of regulating physiology of heart rate and a respiration through feedback until you begin to understand what it feels like, what the state is. That's the feedback part of it. But ultimately, people who practice enough can do this without the benefit of the biofeedback screen. So you're not dependent on it. It is a skill acquisition. And once you acquire the skill using those three elements of slow, deep breathing, mindfulness, and emotion regulation, you can do it anytime, anywhere, sitting at your desk and on the bus and so on and so forth. And you no longer need the biofeedback. So, it's a little bit confusing. We don't want to say people need to always be doing heart rate variability biofeedback, because you don't always need to have the visual feedback from the software that is transforming the signals of your heart rate into visual displays.
So it's almost like it's giving you that intrinsic view of what's happening.
Yeah, that's right.
So,
and it's like muscle memory in a way. If you're getting a golf swing or you're getting a tennis swing and you get it right, and then you keep practicing it, you keep grooving it, it then becomes non-conscious. Heart rate variability, I think always will have, and I haven't really thought about it much, but I think there's always going to be kind of a conscious aspect to heart rate variability. So it's not really a muscle memory, since, cerebral cortex is not a muscle, but it's something that you practice and that you can become aware of. So we were talking about how to promote this, right? And where do we go from here?
Right.
And I think, just heightening awareness through podcasts like this, and just spreading the word. There are strong movements afoot now, and I'm a part of some groups where the idea is to go completely upstream and teach heart rate variability biofeedback in medical school as an intervention. I mean, you can see the sense of that. There's not much we can do in the open market, in the open commercial market, if people want to learn it, they can, and it's a free choice.
Mhm.
But for a professional, whether they're a biofeedback trained professional or a psychotherapist professional or a medical professional, it is something which the more you do it, the more it is. I've known physicians in an oncology clinic who was determined to set up a program whereby he could write a prescription for heart rate variability biofeedback to his patients, which would then enable them to get insurance reimbursement for the equipment, for the software, for the sensors, and for the laptop. But I'm really talking, it's less than $300. It's about $250 for a very, very respectable piece of equipment, not counting the computer, but for the software and the sensors, and that would be then you just learn it yourself. But the more widespread it is, the healthier the population. There are people in public health sectors who want to see heart rate variability biofeedback become a part of health promotion. And it should be. I mean, it's a part of all sorts of health and wellness coaching.
Yes, sort of bigger picture to the mental health crisis going on, teaching people how to be able to integrate that word really stuck out before when you used being able to integrate your emotions better.
It's necessary. It's necessary.
Yes.
If all you do is breathe right, I don't think you've achieved whole health.
Yeah.
And so, emotion regulation, and I've had this argument many times about whether emotion regulation is, essential for coherence. And my answer is it's essential for whole health. And so while you may achieve physiological, and I think there's some evidence that you actually do have a higher level ultimately, but you have to have the emotion regulation for full adaptation to the environment. So, not only do you have to breathe right, but you have to think right too and feel right.
Would you feel comfortable walking us through what a 60-second resonance breathing pattern would be? Or is that something that...
Well, I'm interested. What I would like to do, if it was possible, would be to show you some screenshots. And, if you could, I'm not sure I have lots of screenshots of heart rate variability, of the effects of changes due to heart rate variability biofeedback. And that's very compelling. So if we want to do a screen share, I can show you what happens and how it goes. Really, really sophisticated. And I've seen this done in meetings. A good biofeedback professional can take someone out of the audience, hook them up, have an overhead or a display screen, and be showing the audience the feedback, the visual feedback of heart rate and respiration, and then begin the coaching and begin the training. And after about 15 minutes, you can actually see the pattern shift, in real time. Wow. And I'm not set up to do that, but I can show you what happens from a number of different visual displays. Now, this is a talk from way back when, and it's got a lot of eclectic stuff in there, so we don't have to look at, but I want to go to a couple of, this is all about heart rate variability, and that's how you look at heart rate variability. This is that point about IBIs and how you can have 60 beats per minute, 1 second each, or this little change, 0.9, 1.0, 1.1 have the variability, and the parasympathetic, and there's just a lot of stuff here. But to show you the way it looks, this is telling you, this is a real output. This is a very healthy trace of heart rate, which corresponds, see this little, I can't quite increase, but this right here, that's a peak. That's a 0.1 peak. That means your heart is functioning in exactly the right range of frequency of up and down of IBIs. And you can see this. This is real time during a coaching session. You can have your client create a 0.1 hertz peak right in front of you once they get their breathing under control, because this is telling you that your heart rate, your respiration, and your blood pressure are synchronized. You don't get this peak unless that happens. So here's the way it looks in a real case, and it's real subject data. It's all about breathing and control and lungs and stuff like that. There's the resonance frequency. I'm sure it's here somewhere. This is the setup. This is the setup for heart rate variability. You have this person here is wearing a monitor or a sensor. This person here is looking at a coach's screen. This person here is looking at the subject screen. This has the visual feedback. It may either be graphic, quantitative, or it may be animations. And, I was telling you that some feedbacks will just give you a color. Some will actually, the balloon will float and the flowers will blossom. And all what it's doing there is taking recordings of your heart rate. It's looking for that sign change, or that up and down, that acceleration, deceleration of heart over respiratory cycles. And when you hit it, it'll start giving you graphics. But those graphics are based on the input signals of heart rate, or IBI. And when you achieve a profile of IBIs that is consistent with respiration and with breathing, with respiration and heart rate changes, then you get the flowers. And so people, the veterans generally prefer the quantitative, but a lot of subjects and biofeedback people will get different screens that tell them not so much what the numbers are, but if they're in the right range. So there's the component. There we go. This is what I wanted to show you. This here, and this is a veteran pre heart rate variability biofeedback. This is his heart rate trace. These are IBIs over time, over seconds. And this is measuring, RR is a measure in microseconds of IBIs. Now remember, 1,000 microseconds is 1 second. So when you're around an IBI of 1,000 microseconds, you're at a heart rate of 60 beats per minute, because that's 1 second in between. And so this one here is ranging between, this one actually has been converted to beats per minute. Okay, fine. So he's ranging between, looks like, it's a little hard for me to read that. I'm going to say between, I think it's 50 and 70. I'm not sure, but not over each cycle. You see, he has what's called non-stationarity. So for this particular time, his minimum is here, his maximum is here. At this point, his minimum is here, his maximum is here. But the change from max to min over a cycle is approximately the same. So he's not really getting any benefits of the acceleration, deceleration of heart rate that comes with breathing. In other words, he's not breathing, he's not slow, deep breathing. He has a little bit of a normal trace, but it's not booming, so to speak. After the training, you see that his baseline here, the minimum, is pretty solid. And now the amplitude of these waves is much larger.
Yeah.
So here he's going from a baseline of whatever it is. He's probably increased his heart rate variability on a single cycle. He's probably gone from about, I'm going to say 8 up to about 12 or 15 from max to min.
Okay.
Now, in this case, let me just finish, if you don't mind. In this case here, he's got, and this is just a blow, this is a little more sophisticated equipment. Here, he's way down here. This is your 1,000 microseconds here. So this is around a heartbeat of around 60. And this is just kind of trash. He's getting the equipment going. But here you have these little tiny amplitude, very, very small. He's probably not changing more than 5 beats per minute over a cycle. Here, after the training, it's all gotten focused right here. This is 6 breaths per minute. This is what happens to your heart rate variability when you're breathing. So let me just emphasize that this here, this is seconds, this is frequency. So this frequency here is the 6 breaths per minute. This is seconds, this is frequency. And it's this transformation from heart rate in seconds to heart rate variability at a certain frequency, which tells you you're on track. So here, this is just the frequency. This is the equivalent. These 2 slides are the equivalent of these 2 graphs. So I know from this that his tachygram would be very small and choppy. And I know from this that his tachygram, those waves over each cycle would be large. The amplitudes would be large. And he's probably changing 10 or 12 beats per minute over a cycle. Did I get through it? Do you see what I'm saying?
Absolutely. That's fascinating. And I think it's amazing because with, like we said before, just the simple act of being conscious and breathing deep, slow breaths, diaphragmatic breathing, can change your physiology that quickly.
Correct. That's right. It will. And then the other has to come along. I mean, you have to bring along the mindfulness and the emotion regulation to produce whole health.
Wow. Amazing. Is there anything else? I'm asking this in this fashion because I'm just not sure. I don't know what I don't know. Is there anything else that people should know about this process in case if you've got other questions, by all means?
Well, if I was beginning to work in this area, I think the first thing that I would do when I encounter someone is say, how much do you already know about it? What do you think? Have you heard about it? What do you know? It's deceptive because it seems simple, it seems gimmicky, and people sort of promote it as being, you don't need. It's really very, very, very complex. And so people are going to be at different levels of knowledge and skill. So you'd want to leverage wherever they're at to go further. If they already know about it, you don't really need to do much to advance them, except to encourage them and say it's really good. But if someone comes to you with disordered breathing and a lot of stress and they don't know what to do, they're confused, first thing to do is have a conversation about heart rate variability, biofeedback. What do you understand? What have you heard about it? What do you think about it? And kind of have a conversation like that. And you could do this in clinic, out of clinic, just anywhere, just to promote it. And there are meetings. I'm going to a meeting in Dallas in March, and almost everybody there is going to be expert in heart rate variability biofeedback. So we congregate, from time to time, and you can see how it's grown. You can see how much, momentum it's beginning to build. So I would just increase awareness that it's real, it's effective. It needs to be legitimized to a greater degree than it is as a valid medical practice, and shake off the stigma that comes with it being simple, with it being sort of Eastern, and therefore maybe just kind of, fuzzy stuff that's nothing, but which it's not. I mean, it's deeply rooted, and now it's rooted in science and physiology. And that's what's new and exciting about it.
Brilliant. And I think with all the advances in science and what we've come to learn, it's really validating a lot of what Eastern philosophy, Eastern medicine has been using for centuries. So to me, that's very validating. It's very exciting.
Great. Listen, I know our time's up, but I'm going to finish with this, if you don't mind. Mm-hmm. I've gotten very interested and excited in what's called phytoncides. They're also called volatile organic chemicals that plants, that trees give off. Mm-hmm. Forest bathing, you might have heard of that. Tree bathing, that's for real too. And I'm sort of making this link between, I'm working on making this link between phytoncides or forest bathing and heart rate variability as kind of a natural. So my point being that there are many roads that all lead to the same place. And so, you just one foot in front of the other. And if you're on the right road and you go in the right direction, that's where you'll wind up. Remain curious and open-minded. Yeah. Beautiful. Jack, thank you so much for taking the time to chat with us on heart rate variability. I love this topic, and it's something that I think we're both going to dive into. We've had anecdotal success with coaching clients, using breathing techniques to bring down their state of arousal. And it's a great place to start, with a coaching client, because, it helps them kind of just settle down and be able to be present where they're at. So thank you so much. Friends, if you found the Fierce Planet Adventures podcast helpful, please consider leaving a 5-star review on iTunes or your podcast platform of choice. It helps others find our podcast.
If you screenshot your review and tag us on Instagram, we'll send you a classic Fierce Planet Adventures sticker for your water bottle, cooler, car, Send us a direct message with your mailing address on Instagram, and we'll send you that sticker right out.
Thanks for joining us and live fiercely.